Something that's really coming forward for me is, let's say someone has chronic inflammation, and we're just asking them. We're probably looking at, oh, what's your diet look like, and do you have maybe insulin resistance? These things that are kind of low hanging fruit, but it really is this invitation to go back and look at, do you have some infectious trigger? What was going on with do you have some adverse childhood events? It's this opportunity to dig a little deeper, which I think is really what functional medicine is all about. And I really appreciate that.
Yeah, so I'll just riff on that for just a second. Inflammation has been shown to be part of everything from cancer to asthma to diabetes. And I actually can't think of anything that inflammation is not important in.
Right.
But acute infection and acute inflammation can be valuable. If you get a bacterial infection, your body needs to know to fight and mount a response against that acute injury. But rarely is chronic inflammation helpful. And because of that, your body actually has developed 4 methods for inhibiting or dampening inflammation. There's cortisols, and we all know about that. There's pro-inflammatory cytokines and anti-inflammatory cytokines. So your body has some anti-inflammatory cytokines. There's the JAX proteins. But the key one, command and control, is the vagus. The vagus nerve has a branch that goes down through the celiac ganglion to the spleen and causes the T cells to release acetylcholine on the macrophages and microglial cells in the spleen, and that can inhibit the production of pro-inflammatory cytokines. There's actually this whole reflex arc that's been described called the cholinergic anti-inflammatory reflex that signals to the brain there's inflammation, and the brain then says, okay, turn off, dampen it down. Like a thermostat, it'll just kind of slow it down a little bit. But if you don't have adequate vagal tone, your body doesn't turn off the inflammation adequately. So while I am entirely aligned with the functional medicine team about, okay, how do we get our inflammatory markers down through diet and other strategies, it's important to think that your body has a way of doing that we can help it along with, which is the vagus. That's been established now for 25 years, that we've known that the vagus controls inflammation. Now, originally it was described in the spleen, but we've described the same anti-inflammatory reflex in the GI tract think about inflammatory bowel disease and Crohn's disease and those types of disorders. There's studies that have been done with implanted devices showing that we can, shall I say it, cure Crohn's disease when biologics have failed, because they're decreasing the inflammation through the body's natural method using electricity. And we can find the same anti-inflammatory reflex arcs in the brain, in the pancreas, and other areas as well. But important to recognize that we all recognize inflammation is important, but how do we get it under control? Diet, yes, but your body does it with electricity, and we need to incorporate that in our thought process in evaluating a patient.
Well, and there's something really powerful about that narrative. If we think about the locus of control, is maybe I don't always need these external things, the supplements, that my body is inherently designed to do this work. I just need to give it the tools
That's exactly
that are necessary. So let's talk about that a little bit, about what are we actually going to do. I would love to hear, not all of us are going to go right to implantable devices, right? Mm-hmm. There's certainly so many things we can do to support the vagus nerve. Yeah, that's right. What are the things you start with?
Okay, so first thing I start with is an understanding that the threat is not external, the threat is internal. Mm-hmm. So when you're perceiving your external world, how you interpret it is going to create that as a threat or not. So, if I'm doing a big interview with the famous Kalea Waddles, and I'm doing this big interview, I can choose to get nervous about that the day before and be all stressed out, or I can choose to say, well, at least I can't kill anybody today. And, this will be a fun interview. We'll have some fun together. We'll talk about it. And it's not threatening to me because of how I've chosen to understand it. So it's a very basic thing in interpreting the world around you and not be threatened. That's not always possible, but do your best with that. Second, there's a lot of normal methods that are out there that have been shown to work in many different ways, may not always have recognized that this is a vagus stimulation. Deep breathing, box breathing. 4 seconds in, 4 seconds hold it, 4 seconds out, and start over again here. So there are ways of doing this controlled breathing. Cold water immersion. Putting your face in cold water, part of the mammalian diving reflex, has been shown to activate the vagus nerve. Um, Exercise. Uh, I tell all my patients to exercise because that's been important in activating the vagus. It's good for everything, but it's, also activates the vagus. If I didn't mention pranamaya yoga and other types of yoga, those are shown to activate the vagus. So there's a lot of things that we can do on the spot, from internal locus of control to tuning in our body and understanding what our body is telling us and activating the vagus. Meditation's another one. And, I unfortunately am not very good at meditation, but if you're a Tibetan monk, you can activate your vagus and control your heart rate and heart rate variability really quite well. And I'm a fan. So if you can do that, that's great. The devices that I've built are really for mere mortals who can't do all of these things or don't have an ice bucket in their office that they can stick their head in frequently. 2 minutes of non-invasive vagus nerve stimulation in the neck, there's devices for the ear as well, have all been shown to modulate heart rate variability, activate the vagus, optimize rest, relax, and recovery. So there's starting with just how you think about things, through what your behaviors are, through external devices that are non-invasive, that are very safe, that don't require surgery, are all things that we should be thinking about.
Mm-hmm. So I'm going to dive into a couple questions I have here. Let me go back to, the things like the cold water immersion, just kind of dipping our face in some cold
Yeah.
water, or even the deep breathing. Are these things that we should be doing when we feel our stress response ramping up, or is it things that we do, we wake up in the morning and we just have these ritual of we do these things to kind of keep our nervous system healthy? Do we know? Is it that specific?
Yeah, I think you can do it prophylactically, and most experts in yoga, meditation, etc., would say do it every day.
Mm-hmm.
But I also think it's important to be in tune with your body and understand when it's what we call interoception. We start to note that I'm getting this funny feeling in my stomach, or people all feel it um, and can have different organs targeted, so to speak. But when you start to feel yourself becoming anxious because your stomach's in, your muscles get tight, great time to intervene, stop, and do whatever intervention you do to try to get yourself and the parasympathetics under control. So the answer is yes, both. I would do it prophylactically, and I would suggest doing whatever intervention you do um, on the spot. So with some of the devices that I've worked on over the years, we have devices that work to prophylax and stop a migraine from coming, prevent migraines. But if you feel a migraine coming on, you can use it as an acute treatment as well. And these are studies that have been FDA approved, looked through by the FDA, and granted, clearances for acute treatment as well as prevention of migraine. So in summary, I'm saying, yeah, both are good, and each person is different and individual. Some people just need to have a baseline improvement, and then some people need a tool when events get out of control for them.
Well, now I have to tell you about my N of one experiment that I did on myself, where I took my blood pressure and then I did humming
Yeah,
exercises,
yeah,
toned the vagus nerve, and then I rechecked it, and it had quite a profound effect,
yeah,
actually.
yeah. So it really does, and I should have thrown that as another one, which is there's a whole school of thought on music interventions. Um, Humming activates what's called the recurrent laryngeal nerve, which is a branch of the vagus, right? So it's kind of funny how this all kind of comes together. But
Mhm.
uh, facial expressions and humming and singing all can be shown to activate the vagus. That's an important aspect of physiology. There's another aspect that's really, I think, interesting to me is there are music patterns that have been shown to activate the vagus. There's Steve Porges, who I mentioned earlier, came up with Safe and Sound protocol, and he's got a new one now that's working on activating the vagus by entraining the body's nervous system to internally activate the vagus. So there's so many different unknowns here and pieces of this journey that we're going to be figuring out.